We are very, very pleased today to receive a delegation of ambassadors from the Nordic country, and this is from Denmark, Finland, Norway and Sweden. 4 Nordic countries, and I would like to first of all welcome them. The Nordic countries, in collaboration with the United Nations Fund for Population Activities, UNFPA, have been supporting our county since 2015, especially on issues of health, and more so focusing on maternal health, child health, family planning, and also issues of reducing gender-based violence, FGM, all those gender-related issues. So I would like first of all to thank them for that partnership with UNFPA that has assisted us at our hospital and at our health facilities. We also receive regularly the Danida Fund for improving our rural health facilities. We really appreciate that, and we receive it very regularly. It's a performance-based funding, and we're very, very grateful. Today we had discussed how to strengthen that, because the world is coming next week to Kenya for what's called International Conference on Population Development. And this is the 25 years of population issues being addressed in the world since it was initiated 25 years ago in Cairo. And therefore, as a way of, number one, assessing what achievements have been done, and also as a way of what this discussion coming next week should entail, and also as a way of how next maybe 25 years will look like. So the world is coming together in Nairobi for that, and since there are serious participants in matters population, they have come to join us, and they have been supporting us since 2015 through UNFPA. So they are coming now around to share with us and hear from us what improvements and what challenges we are facing on health issues for mothers, health issues for children, and how we are tackling the issues of girl-child, especially female genital mutilation, and education for girl child. And we have talked, and we have explained to them how we are approaching health from rural perspective by empowering our communities through community health strategy, our partnership with Living Goods, that actually is slowly revolutionizing the prevention of diseases at the last mile, at the community level. And we just got an announcement actually that this model of ours has now been picked by Ministry of Health as a pilot, so that it could be rolled out to the other 47 counties. And I hope we will be able to prove to the country and to the world that UHC can only be achieved if we strengthen, number one, the community health services, and that way we could deal with 60 to 70% of the health needs of our people, and obviously then we improve our other levels, level 2 and level 3, and our referral facility, which we keep now improving in partnership with our donors. So I will like to say karibuni sana, and maybe they will also like to say one of few things. From here we are going to tour the hospital, and they will be able to see the kind of things that the improvements we have done to the hospital. But more importantly now, this hospital feeds into the rural strategy that we have, both for level 1 and level 2, but also this now is a teaching and referral facility, which actually then plays a major role in making our referrals function better. Thank you, welcome, and each one of you can say a few words.
Thank you. Okay. Thank you very much, Governor, for this warm welcome to Isiolo County. It's very good to be back here. I just want to echo what the Governor has said, that we've had a very good discussion about the approach to providing health services in Isiolo. I think we're all impressed with the strong focus on improving primary health care and reaching the population where it is through the community health workers. We think that sounds like a very good approach. Also the fact that these health workers can work across the border on issues that have an enormous impact on, for example, maternal and child health. On the conference that's coming up next month, the International Conference on Population and Development, I want to say that the focus of that conference is really also to try and reach the objectives that are still outstanding. So some of the focus areas of the conference is to how to find methods and how to find financing to achieve the situation where we have zero maternal death, we have zero preventable death of infants, and we have zero unmet needs for family planning. And I think that the strategy that we see here in Isiolo with the focus on primary health care is one of the ways that we need to go to obtain those goals. Thank you very much. Mette Knudsen, Ambassador of Denmark. Thank you.
Your name and say something?
Yes, well, my name is Erik Lundberg and I'm the Finnish ambassador, and I also want to commend the governor and the people of Isiolo for this excellent work that they are doing in this area. And I think what the governor and my colleague was alluding to, which is really involving people at the grassroots level through education, through awareness raising, but also using perhaps modern technology such as e-health solutions is really a good way to move forward. And when you are even able to link perhaps private-public partnerships to that model, I think it sounds like a very interesting project, and I wish you the best of luck with this pilot, and I hope really that it would be a useful one that then can be rolled out in the rest of the country if successful.
So my name is Anna Jardfelt. I'm the Swedish ambassador to Kenya, and I'm also delighted to be back here in Isiolo. And just to explain a little bit what we are doing here. So we are the 4 Nordic countries, and we try to travel in Kenya as much as possible together, both because we share a lot of the views, but also because we have a lot of the same political focus. So it's very easy for us to travel together, and we also think it's an important signal to give on that we have these joint political aims, and we are working in the same directions. Also, as big donors here in Kenya, we believe that this is an important signal. As my colleagues have already explained, the reason for this trip is to put particular focus on the ICPD 25 conference that will convene many thousands of people in Nairobi. And from all of our countries, sexual reproductive health and rights are a very, very big focus in everything we do, in politics, but also in development assistance. So we felt that it was important to come together and give this joint signal and travel together around in Kenya. And we chose Isiolo as one of our destinations. Thank you so much.
My name is Elin Bagitrungli, and I'm the Norwegian ambassador to Kenya. I also would like to echo my colleagues. It's really a pleasure to come here and specifically to learn from your important plans and how you practice your work to be in a better position. And I also must say that we are also very impressed of how you go down to the community level and start from there, because that's, I think, where the changes has to be. And I also would like to say, as other colleagues here, we are a big supporter of health and education agendas and the specific topics that we are talking about here. So for us it's very important to get out and to learn from what you're doing. And also would like to underline that gender equality is the key, I think, for changing these harmful practices that we talk about. And another very important issue is, of course, the education. So we have also talked about these issues, and I'm very glad to learn that you are also focusing on education and these other issues. So thank you so much, and thank you for having us.
We have their support in Isiolo is channeled through UNFPA. We have a representative of UNFPA, and I would also like to invite him to say a few words. And we appreciate the partnership we are having with UNFPA, especially at our health facility. And so let him also say a few words.
Thanks a lot, Your Excellency. This is, our feeling, UNFPA team here, and I hope you agree with me that we have model of ICPD summit here today, because we look at what was achievement in this governor under your leadership and our partnership, and we also found out unfinished business, and we are committing that we will address to that unfinished business in this country. The same thing we will do 12th and 14th November in Nairobi, where we will look global unfinished business, as well as about 180 countries will come minimum. They will also tell what is their achievement, what is the unfinished business, and through global commitment we will go for each concrete government, including Kenya, what will be national commitments in order to accelerate that promise what we did 25 years ago. Thanks a lot, and we will move with this collective commitment further in this country also. Thanks.